everyone. My name is Amit Kakumanu. I'm so excited to be presenting about the impact of food security on dental caries in children. So to start off a little bit about myself. In school, I'm a sophomore in 10th grade at Brooklyn Tech, which is one of the largest public schools in New York City. I'm the junior varsity director of Public Forum Debate, which I actively compete in and really love. I'm also a member of the Learn to Be Tutoring Club, which helps tutor underprivileged students for free, which is truly one of the most fulfilling activities I do. Above is a quick logo of my school. And then outside of school, I'm a research assistant at the Icahn School of Medicine, affiliated with Mount Sinai Hospital. I'm a member of the High School Law Institute at New York University to pursue my passion for social justice, and I love food. Above is a photo of a pomegranate, which is my favorite food. And this is a quick photo of myself. In the future, I hope to be an oral and maxillofacial surgeon, though that's a long way away. So first, I really want to start with some definitions for the research. Starting off with food security, which is quite multifaceted. Firstly, it's how easily a person is able to access food in a safe way without going through extenuating circumstances. Secondly, the ability for someone to eat enough food that's high quality to meet their bodily requirements, for example, calorie intake, and then dietary restrictions, for instance, being gluten-free, pescatarian, or religious requirements. Thirdly, the consistency of a strong supply of food, because you can't be food secure if you don't get consistently adequate amount of food. And fourthly, it's truly the social and economic conditions that shape a way that a person has a relationship with food. For example, how safe their environment is, for example, sanitation services, parents' level of education, and so much more. This is an extremely pressing issue, as the World Health Organization in 2023 reported that around 2.33 billion people globally are facing moderate or severe food insecurity, which is unfortunately accompanying the rise of issues like war and climate change that have left many children food insecure. It's also important to go over dental caries. Dental caries are a form of tooth decay. They also encompass cavities, and they're holes or parts of the teeth that have been decayed. Big reason why they occur is really bad diet quality, which comes from consuming tons of sugars and are being malnourished. And then this is a photo of them, and you can see there's also a little bit of staining on the teeth at times too. This being said, when we're setting up our research, it was super important to take into mind the link between food security and diet quality, which we know causes caries, because although it's assumed, it might not necessarily be inherent. But it does turn out to be that kids who are more food insecure do tend to have lower diet quality scores. This often means they're consuming much less fruits and grains, which is important because even if kids consume the same amount of food, the breakdown of that food really does determine if they're healthy or healthier or not. And secondly, there's a strong correlation between being Black and Hispanic and having lower levels of food security, which is unfortunately due to the way our society is structured. Now, our research was across 2,574 participants in children's aged 1 through 18 years old from the National Health and Nutrition Examination Survey. We looked at how food security influences diet quality, which we know leads to dental caries. And our study investigated things like demographics, so sex, age, gender, poverty to income ratio, and we also looked at specific parts of the diet, for example, selenium, fruits, veggies, sugars, and then those links we were talking about. So diet quality and food security via the Healthy Eating Index score and a child's food security category, so fully, marginally, etc. And then really personal questions. So when did you last go to the dentist? What was the date of that? How many times do you brush your teeth a day, etc., just to get an update on their dental hygiene. Now, our research findings were really interesting, and one of the things that we used to really make them quite impactful was a variety of statistical analyses. So first is rho, and rho looks at the strength or the relationship between a linear correlation that goes from -1 to 1. The closer you are to either extreme, the stronger it is. And then positive is as x increases, y does, and then negative would be that y decreases. And then secondly is the p-value, which identifies if a correlation we're seeing is statistically significant, i.e. is what we're seeing due to just random assignment, or is it actually due to the variable and not, let's say, 20 other variables? And this is usually less than 0.05. Thirdly is R squared, which examines how much a variable can explain another, how much can one variable explain the difference or the contents that we see in another. And we all used RStudio to do all this data. If you're looking for great data analytics, it's absolutely awesome. So going into our results. So first we looked at total fruits and total healthy eating index, which is the HEI score. And as you can see, the p-value for all of these are super small, so it's definitely statistically significant. But we found that eating more fruit does lead to higher total scores and actually explains 9% of the variance that we're seeing, which is a really big amount considering that fruits, although it seems like a small part of your diet compared to for example, grains, carbs, and then also age, income, race, etc., is a lot of actually healthy eating index scores. Secondly, we looked at mean carbs and mean sugars, and here it's really strong with Roe at 0.82. And actually, R squared is 0.48, which really does show that the variance in carbohydrate consumption affects 48% of sugar consumption, which unfortunately does prove that kids aren't getting their carbs from healthier sources like, let's say, potatoes and yams, but unfortunately more unhealthy sugars due to the way that our industry market these products to kids. Another interesting thing we looked at was more so social factors, for example, the ratio of family income to poverty and maternal education, which may seem like an unlikely link, but Roe is at 0.45, and we can see that a general higher income, for example, more money compared to poverty, does lead to greater levels of education. And that explained 23% of the difference, which is a lot actually when you think about all the other factors that impact education. For example, if a parent in your family had education, your race, etc. And then more interesting things we noticed was that the average number of decayed, filled, or missing teeth, so these are caries or what used to be caries, was about 4. The average HEI score was 49.8 out of 100, which is really quite low. But the average food security was between fully and marginally food secure. So fully was 1 and then marginally was 2. So 1.46 is kind of right in the middle, which is actually quite striking because it shows you that although kids were trending towards being fully food secure, at least marginally food secure, they weren't necessarily too healthy, which is all due to the breakdown of that food, which is a staunch problem we're facing in America. Now, I just want to talk about a potential solution. Dr. Sonia Angel mentioned this so well, targeting specific groups. So governments could establish more programs working to directly reduce food insecurity, allowing them to create stricter guidelines on food requirements, which would lead companies to remove these added sugars instead of replacing it with junk, which would advertise alternatives that are truly healthier for children. And then kids, if possible, can communicate with a trusted adult or organization about food insecurity, questions they have on their status, etc., and take a touch more time to look at the contents of their food. But it brings me to something I want to tell you all, which is I really want you to think about how you can help strengthen food security in your community. Many of us has local banks and shelters, and it's so important to participate because having food security really does stem from strong, consistent community support. Now, some references. These are all the sources for my data. And then I also want to acknowledge a few people. Thank you so much to the Icahn School of Medicine for giving me the opportunity to be a research assistant. It's so amazing. And then thank you to the Smart Doc program at Mount Sinai, which is allowing high school kids to gain exposure to research. And this is really great under the mentorship of Dr. Adaronke Akinkube, who's our mentor, who's absolutely amazing. And to my mom and family, you guys have always supported and loved me. This is actually my mom on the bottom right. And then I also just want to say thank you so much to the audience. Thank you so much for tuning into my presentation and being a great listener. It's always a really great treat. And then contact information, Amit Kakumanu, Amit Kakumanu 2009 at Gmail, and then my LinkedIn. I know I said ice cream isn't too good, but I really love sweets. So yeah. And then I also just wanted to say thank you so much again for tuning into this presentation, and I really hope you gained something from it. Thank you again.